Hello everyone and welcome. My name is Ash and today we'll be talking about rehabbing an overused or overloaded shoulder injury. If you want an explanation as to why you have your pain, you can choose that in the time frame. If you're not interested in doing that, you can jump straight into the video and I'll be showing you 3 different rehab exercises for your shoulder.
So this is the rotator cuff complex. It consists of 4 different muscles: the supraspinatus, infraspinatus, subscapularis, and teres minor. The anterior view means it shows it from the front, and that's where you can see the subscapularis, which helps do internal rotation, and then you have the other ones seen from the back. We don't call this type of injury a shoulder impingement anymore. We just call it a rotator cuff tendinopathy. And this picture here shows some of the rotator cuff problems we can see in our patients. It could be the supraspinatus or the subscapularis that can be injured. Usually it is the supraspinatus, but it might be one of the others as well. The healing time is usually 12 weeks, might be more depending on how long you've had the injury, might be less depending on the individual and how fast you are reacting to it. Let's get to the exercises.
The first exercise I'm going to be showing you is an external rotation. You're going to need a resistance band, grab it into your side, elbow to your side, then you're externally rotating there, trying to keep in the elbow to the side, and then counting 4 seconds back. So 1, 2, 3, and 4. Out there, 1, 2, 3, and 4. On a scale from 0 to 10, you're allowed to have a pain level up to a 4. And while doing the exercise, you should focus on the slow eccentric back. Do 15 repetitions of 3 sets. If you're not able to do it with a resistance band, you can either use the cables in the gym, adjust it to your height, and then going out there. And if not possible, you go down with me, down here in this position. You grab a weight, put your elbow on your knee, and then you externally rotate from this angle right there. 1, 2, 3, 4, and go up there again. Same goes for the other exercises, 15 repetitions of 3 sets, but choose just one of them. The second exercise we'll be doing today is the internal rotation. So this time we're imagining that it's the left side that is injured. You start right out here. So before we did the external rotation, this time we are internally rotating. So you go in here and count 4 seconds out this way. Try to hold it in. Go as far out as you can. Bring it in. And there again. Same goes for this one. You can do the cables if you want to. 15 repetitions of 3 sets. Usually this is the easiest one of them. The third exercise is going to be scapular raises. Usually when you do a lateral raise, you do it in this position and lift your arm above the 90 degrees. When doing the internal rotation in your shoulder, usually that's the pain cause for you when you go above the 90 degrees. So what we want to do instead is externally rotating a bit and then lifting your palms up in a 45 degrees angle. So if you were to imagine 90 degrees here, you want to lift up in 45 degrees angles in the scapular plane. So it looks like this, here, grabbing it, going elbow to shoulder height, and then in again. Up there and counting 4 seconds down. Again, eccentric is really important, going up there. Back again. If you were to see it from front, it would look like this. And the same applies here, 15 repetitions of 3 sets. So these were the rehab exercises for an overloaded or overused shoulder injury. These exercises might not be enough for your specific injury. If they are not enough, you can either book an online consultation through Instagram or commenting down in the comment section, or doing the same on Instagram, but these might not be enough. Remember that. And you can either book an online consultation or buy a full rehab program through Instagram, TikTok, wherever. Thank you for watching. Remember to either subscribe or follow, send it to a friend, like the video, and comment the next injury you want to see.